Hello, everyone. My name is Autumn Knight, and today we're going to be talking about A1Cs. So, topics for discussion today will be blood glucose versus A1C, symptoms of diabetes, types of diabetes, diagnostic testing, the importance of A1C monitoring, and how to lower your A1C. So, first off, what is blood glucose? Blood glucose, also known as blood sugar, is the main source of energy for the body. Glucose comes mainly from the carbohydrates we consume, which is then converted into energy with the help of the hormone insulin. Insulin moves the glucose out of the bloodstream into your cells to be used for energy. When there is an excess buildup of glucose in the bloodstream, this is called hyperglycemia, which in comparison, hypoglycemia is low blood glucose. Blood glucose ranges vary depending on whether you're fasting or have already eaten. So, a normal or optimal blood glucose range is between 70 to 90. And then prediabetes can be indicated between 100 to 125. And then anything above 126 on two separate occasions can indicate diabetes. There's also ranges called postprandial, which just means after eating, so you're not fasting. An optimal blood sugar after eating should be anything less than 140. After eating, anything between 140 to 180, again, can indicate prediabetes, and anything more than 200 after eating on two separate occasions can indicate diabetes. So what is A1C? The A1C test measures your average blood sugar levels over the past 2 to 3 months by determining the percentage of hemoglobin that has glucose attached to it. Since red blood cells have a lifespan of about 3 months, this test provides a long-term view of your blood sugar control. A higher A1C percentage indicates higher average blood glucose levels, which reflects on poorer control and increased risk of diabetes complications. So looking at the ranges of A1Cs to help you indicate if you're in a normal range, a pre-diabetic range, or a diabetic range. So anything below 5.7 indicates a normal A1C. Anything between 5.7 and 6.4 indicates prediabetes. And then starting at 6.5 or higher indicates diabetes. So there are several symptoms that can be warning signs of diabetes. Most common we know is the three Ps, and this is polyuria, polydipsia, and polyphagia. So polyuria is when excess glucose circulates in the bloodstream. The kidneys work overtime to filter and remove it, and due to this, they pull water from the blood, which then fills the bladder more rapidly, leading to increased urination. And this is the body's attempt to eliminate the excess sugar through the urine. So, in essence, it kind of acts like a diuretic. Polydipsia is also known as excess thirst. It's a common symptom of diabetes, and it occurs because high blood glucose levels draw fluid from your tissues. And as your kidneys work to filter and remove this excess glucose through the urine, your body loses significant amounts of fluid, and the fluid triggers your thirst mechanism, leading to an intense excessive thirst. And then lastly, polyphagia, also known as excess hunger. This is a common symptom of diabetes. Particularly, you'll see this in type 1 diabetes, and it occurs because the body cells aren't receiving the glucose they need for energy, essentially. You can also experience blurred vision, and this is basically when your blood sugars are uncontrolled. So you either have a spike or a drop rapidly in blood sugar. You can also have fatigue, which is when hyperglycemia prevents the body from using the glucose for energy, which results in the cells not functioning properly. And then lastly, you also have an increase in infections. So if you're noticing more UTIs, yeast infections, or skin infections, then this could be an indicator for diabetes. So looking in comparison, just a little background on diabetes. So type 1 diabetes is an autoimmune response. So it's basically the immune system attacking the pancreas. So the body is unable to produce enough insulin, and it affects about 1.9 million Americans. And the treatment for this is you're taking insulin every day because your body is not producing it anymore, and it's a lifelong disease. Type 2 diabetes, on the other hand, is normally caused by lifestyle factors or genes as well. This is when the body becomes insulin resistant, and normally type 2 diabetes accounts for about over 90% of all diabetic cases. So this is the more common type of diabetes. And treatment for this is lifestyle changes, exercise, medication. And it is possible to go into remission. A lot of times when you have an indicator of prediabetes, you can often already reverse this with diet and exercise. So how to measure? You can check A1C through a venous draw, which is where you'll go into the clinic and they'll draw your blood. They'll send it off to the laboratory and it'll take a couple days and come back and it'll be able to tell you your A1C reading. Or you can use this A1C Now machine, which is what I have been using in my clinicals for community health. It basically is a finger stick and you use it. It takes about 5 minutes to give you your A1C result. So it's very convenient. It's a lot faster. Of course, we always recommend, to go regularly to your doctor and get checkups and your labs drawn as well. But this is just really a good indicator and convenient way to check your A1C. First, you're going to grab your A1C Now machine, and then you're going to grab your two kits. So this is kit 1, and it has the shaker body as well as the blood collector in it. Then you're going to grab kit 2, and this has the cartridge to insert into the machine. You're also going to go ahead and grab your alcohol swab, your gauze, and your lancet. Right here, I'm just cleaning off the finger that I want to prick with alcohol and letting it dry for a couple seconds. I'm preparing my lancet, and then I'm going to do a quick stick. Once I've stuck my finger, I'm going to go ahead and squeeze some blood out. You have to make sure that you get an adequate amount, because if you have too little or too much, then the machine won't read properly. So here I am collecting the blood. And then now you'll just apply a little pressure to your finger with the gauze. I'm multitasking here, so I'm going ahead and putting the blood collector into the shaker body, and you'll feel it puncture through. I'm going to make sure my cartridge is inserted into my machine. It'll instruct you on the screen to wait and then tell you when it's ready for the sample. So now it's ready. So I'm going to take the cap off of my sample and just puncture it down in there. And then now you'll wait exactly 5 minutes to get your result. And then once it's done, it'll come back and it'll tell you your A1C. So that one is an example of me using the A1C Now machine at clinical when I was doing my teaching project. Um, as you can see here, it's very convenient, it's quick, it's painless, and it's a good way to check your A1C. So the importance of A1C monitoring, regular A1C monitoring is crucial for managing diabetes because it provides a long-term view of blood sugar control, unlike daily glucose checks. And by reflecting average glucose levels over 2 to 3 months, it helps healthcare providers assess the effectiveness of treatment plans, identify trends, and make necessary adjustments to medication, diet, or exercise. And this proactive approach helps minimize the risk of long-term diabetes complications such as nerve damage, kidney disease, eye problems, heart disease, and ultimately improving overall health and quality of life. Lowering A1C. So lowering your A1C involves a multifaceted approach. You want to prioritize a balanced diet rich in whole grains, lean proteins, and non-starchy vegetables while limiting sugary foods and refined carbs. You want to engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week, and adhere to your prescribed medication regimen and consistently monitor your blood glucose levels. It's also important to work closely with your healthcare provider so that they can adjust your treatment plan as needed and incorporate other techniques that might be needed to help manage your A1C. So here are just some pictures that I included of me at the YMCA, and I was doing my teaching project, educating patients about A1Cs and performing that with the A1C Now machine. It was really beneficial and rewarding because a lot of these people that I checked their A1C, there was an education barrier. They didn't know much about it. A lot of them thought that it was just a normal glucose check and not an A1C check. So, I had to really explain the difference between what the ranges meant for an A1C, how they, explain uh, indications of prediabetes and diabetes. There was actually a couple patients that were in the pre-diabetic range, or there was one patient that was also in the diabetic range that didn't know but had a family history of diabetes. So it was really good for me to be able to talk with that patient and educate them to follow up with their PCP so that way that they could go ahead and manage it. And it was good for us to check the A1Cs because a lot of these people were able to have an early detection of the prediabetes or the diabetic range. So it was very rewarding and I enjoyed it. This was just some resources that we handed out. So this is just a booklet. It's called Know Your Numbers. We use this regularly for our screening services. We have other things that we screen for during clinical, such as BMI, blood pressure, and all that. But this is just the page on A1Cs. So you can tell that it breaks it down in simpler terms as well for patients to understand. And also within this booklet, it has a range of normal A1Cs, prediabetes A1Cs, and diabetes A1Cs. So it's very good. It provides a lot of information. It compares the A1Cs compared to glucose levels and also gives them some instructions how to go ahead and start changing it on their own through diet and exercise. Also in this book, it has where you can fill in information like the blood pressure. If we took that, we were able to write down their A1C number so that way they can take this book directly to their PCP so that they can follow up with it. And then these are the references I used. And that's all. Thank you for listening to my presentation. I hope you learned a little bit about A1Cs, and thank you for your time.